Hello, my name is Matthew Newell, and I'm the co-director of the Family Hope Center. And I have the privilege today to be sitting with our medical director, Dr. Kristin Reihman. What we want to do is just share with the families who you are and what you bring to the team, and the fact that you've been traveling with us and seeing families on an intimate basis for the last 6 years. How do you see the Family Hope Center? How do you see this as our medical director, but also as a physician? And how you would talk to parents about this, about what you do, and maybe some other physicians who could be interested in working with us, and what would you say to them?
Well, the first thing I would say is, starting with that last question, I would say this is a place that I wish I'd known about in residency and medical school. I wish all doctors knew what you teach, and I wish all parents had the information that you provide, because it could drastically change the trajectory of the well-being of their children. But getting back to your first question, I am a board-certified family doctor, so I trained in family medicine and have a heart for families and for teaching parents the things they can do to make their families healthier. I found the Family Hope Center after an illness that I had. I had Lyme disease and was very ill from that, and through that process realized that many of the things I had been doing for myself and my family weren't actually optimally healthy, including eating a diet that I learned in medical school was an appropriate diet, but in the end ended up not being that great for me. So much of what I've learned since that illness, I bring to bear on my work at the Family Hope Center. And I'm really grateful for that experience, because it taught me so many things that, again, I wish I'd known a lot earlier.
And what kind of capacities would you want to say to them that could be assured that, you're helping them?
Yeah, well, I guess I'll start by explaining a little bit about what I do here. So when families visit our office for 2 days, the first day I see them in the role of medical director, and I do a complete history and physical and make sure that they're healthy or on track to becoming healthier, that they're safe to do the program. There are very few children who aren't safe to do parts of our program, but I want to make sure that we cover all our bases and make sure there aren't heart and lung conditions that might keep them from certain aspects. And I also really listen to the story and try to understand what are the different pieces of the history that might be clues about what's going on in the gut, what's going on with inflammation in the body and brain, where are the different things that I can plug in my knowledge about healing to help them take their health to the next level while they're doing the program, and as a way to make the most out of the program. The most important thing I think I bring is an understanding of nutrition, which, by the way, I didn't get in medical school. Doctors aren't trained in nutrition much, if at all, and if they are, it's really not correct information that I learned. So I have, over the many years that I've been doing this and studying this on my own, I've learned a lot from the Institute of Functional Medicine, also from the Weston Price Foundation, also from the nutritionist who works for you and travels with you sometimes when you travel.
Right,
so
Dr. Corley.
Dr. Corley and Andrea Stevens, and really pulling together all the work they've done to create a nutritional program that I really see every day helping children thrive. I mean, it's the same program I use now for myself and my family. And it's amazing what happens when children and adults are eating a diet that is nourishing, has all the important macronutrients and micronutrients, limits carbs so that they don't overgrow the different organisms in their microbiome that can lead to behavioral problems, ups and downs in blood sugar, ups and downs in energy, erratic behaviors, sleep problems. I mean, all those things get better when you heal the gut and eat appropriately.
Yes.
So that's something I'm really excited to be able to bring to families here. And that happens on the second day of their visit. We talk about nutrition.
Right. And we follow up families, and we take care of them, and we answer all their questions. And then when they get a little bumps in the road, they can call us and call you, and we can continue to coach them. And every 6 months we work to support their physiology. If they have toxins, we look to eliminate toxins. We look to give them any nutritional supplementation that's on the organic side to bolster their immune system so they can, be able to get up every day and work through their neurological restoration in the highest quality way, especially parents who tend to not put themselves first. Yeah. I've seen you many times sit with the mom and sit with the dad and say, hey, no judgment here, but we got to take care of you first.
Absolutely.
And
I think
and they receive that very well from you.
I think the ceiling on our children's health is directly related to our own ceiling on wellness. And so as a family doctor, I've always felt like it's important to focus on children, but really it's important to empower the parents because they're the ones who are buying food, making decisions, deciding what kind of air filters to buy, really learning all this in
And it's not easy to change all the ideas that's out there that you've been doing for years and years. You have these habits, but to shift to another type of thinking, you've been patient with families and you show them the scientific rationale, and you actually teach a lot of families, even in your private practice, about health. Your book came out on Lyme's. You coach parents and coach individuals on how to do that. So you lived a life of healthiness and trying to innovate. So we appreciate that very much, being plugged into the Family Hope Center.
Well, I'm really grateful to be here with this team. It's a gift to be able to share what I've learned, some of it the hard way, but have learned that can make lives so much better, whether you have a hurt child or not.
Yes, absolutely. So thank you, Dr. Kristin. It's a pleasure to have you. I'm very grateful you're part of our team. I love bringing people that are a lot smarter than me and surrounding myself with such intelligence, and you're one of those people. So
Thanks,
we
Matthew.
really
I love being here.
love having you for
Happy to
sure.
be here.
So great.